Hey everyone, thank you for joining the Behind Company Lines podcast today. We have Arup Roy-Burman, physician entrepreneur, co-founder, and CEO of Elemeno Health. Elemeno Health is a software company that empowers frontline workers. Arup, thank you so much for joining today. And nobody saw this prior, but I'm just going to give myself away. I had the hardest time with your name. We'll have some outtakes there. But before we dive into what you're doing now at Elemeno Health, I would love to learn a little bit more about what you were doing before you started Elemeno Health and becoming a Y Combinator alum yourself.
Yeah, so before starting Elemento, I spent 20 years in clinical practice, working in pediatric critical care, so in the pediatric ICU. And that took me through a lot of the big name hospitals here in the Bay Area: Stanford, UCSF, Kaiser, Children's Oakland. And really had the privilege of working with fantastic teams.
Yeah.
Dedicated, hardworking, frontline nurses, techs, residents, all working together to help to save lives of children. So that's what I used to do, and what I still do a little bit of. And I was medical director of the ICU at UCSF Benioff Children's, San Francisco. And for me,
go ahead. No, I was gonna say it's interesting. You don't see a lot of physician entrepreneurs, which I think you have one of the coolest titles of any of the founders that I have on the show. There's others that have cool titles, I promise. But as a physician and an entrepreneur, where did this culmination? I'm sure there was some curiosity, some level of insight that you have that maybe gives you a little bit of an edge. But what was the inspiration for starting the company? Being a physician and then moving into entrepreneurship and tech.
Well, the inspiration actually goes way back. When I was like 4 years old, my little sister was born, and she had congenital heart disease. Something that was very treatable then. And when I was in second grade, she went to the operating room for what should have been a simple surgery. There was a mistake made in the operating room, and she died in the OR. That was my first experience with a medical error, and it was my inspiration to go into medicine, to go into pediatrics, to go into critical care, and take care of children like her. But in that career that took me through so many wonderful, top-rated institutions, I continued to see children dying from preventable mistakes. Mistakes made by well-intentioned, hard-working, well-educated staff who simply couldn't pull the information they needed when they needed it. And we would look back on these types of events, and they would happen not my department, across the whole hospital. We'd look back on major safety events, and it was that the hospital said, we know this stuff. We know this is an organization, but our front lines can't remember it because the sheer volume of so many things that are changing so much. We've seen them more than ever in COVID, right?
Yeah.
And we asked the question of, why is it in the consumer space that technologies like this, mobile and otherwise, are the great enablers, right? They connect us. This is what we need when we need it.
Right.
Why can't we have those, privileges in healthcare where the stakes are so much higher? That was the inspiration to make this happen.
Yeah, so it sounds like, which is bizarre, and thank you for sharing that story. Is it? Do you see that it's sheerly just like the quickness of the information, or the like having it kind of stored and memorized, or is it like both? What do you think is like one of the main issues?
We, as a patient, you go into healthcare, you expect not just your doctors, but the nurses and everybody to know everything.
Right.
But that's impossible.
Yeah.
It's impossible. There's so much. And it's constantly changing.
Yeah.
And for those frontline staff, when they can't stay on top of it all, one, you have to make information accessible.
Yeah.
But nobody wants to read 15 pages in the moment.
Right. Yeah.
You find that policy on something. It doesn't help me when I'm trying to take care of the patient right here, right now.
Yeah.
You have to also transform that information to make it digestible in the moment. You were talking at the beginning about, hey, this podcast, bite-sized nuggets that go to people, or the TikTok videos that you create.
Yeah.
People want something short, sweet, and to the point. And that's where we come in. We help to transform that organizational knowledge into those bite-sized nuggets that are not just accessible in the moment, but digestible in the moment.
Yeah. Describe for the audience what you categorize as frontline staff and how critical it is for them to receive this immediate information.
Yeah. So I'll take the frontline staff and I'll call them as frontline teams.
Teams.
When we think about healthcare, or the lay public thinks about healthcare, they often think of the dyad of the doctor and the patient.
Right.
But what they forget in there is that in between, who's actually delivering the bulk of that care? The biggest group is nurses.
Right.
But there's all kinds of ancillary staff. There's the respiratory therapist, there's the x-ray therapist, there's the physical therapist, all of these other people that are delivering the care. And technology has forgotten about supporting them. Mm-hmm. That's where we come in. And when you look at healthcare is really a team effort. It is position players, different professions, working together to get the win. And I'll use an analogy. I'll take here a sports analogy. Mm-hmm. If we take, for example, football. In football, when we think about the sport, there is a rule book. How many people have ever read that rule book?
Very few.
Almost nobody.
Yeah, those who do have a leg ahead of the game, right?
Yeah, exactly. But there's a rule book, mm-hmm. and then you've got the locker room where you've got the X's and the O's. Right. Those are the training. They've given you some more about the what and strategy. A little bit of the how to do it. Right. But it is non-contextual. It's often in one ear and out the other. And what do they care about most is when they're in the huddle. Somebody's looking down at that little thing on their wrist. What's the play that we're running right now? A play that is customized to your teammates, to your opponent, and the specific field you're on today. Yeah. Healthcare is really no different. We have policies and procedures that govern, mm-hmm. that are indigestible in the moment. Mm-hmm. There are staff meetings that are disconnected in one ear and out the other. Mm-hmm. What they need is the playbook in the moment. Yeah. There is no playbook. Wow. It's a mess of binders, flyers, posters, putting things above the toilet in the bathroom, throwing things to your SharePoint on the internet, and in desperation, people go into Google and search, and God knows what they're going to find.
Do you think
that's the world we reflect?
Is it part of the, you make this playbook analogy, is it part of the playbook, or is it knowing the situation? Because I know from what you said, doctors and nurses, they know the plays. They have this information at their disposal. It's about using it. Do you feel that it's more, lack of playbook or lack of knowing the situation?
I think they can know the situation. So it's the know that they can start to gauge what the situation is. Yeah. It's like, okay, now what do I need to do? And whoa, how do I actually do it? How to do it is going to be dependent on my own specific equipment, my own specific supplies, my own specific patient population and resources. Mm-hmm. That's where hyperlocalization really comes in. Mm-hmm. It's not about give me the high-level best practice guideline. Yeah, I need to actually make that actionable. I need to actually do it. And that's the problem in the moment. How am I accessing this special kind of IV? Mm-hmm. How am I rolling out this device that I haven't used in 2 months, right? Right. How do I prime this circuit? Or, monkeypox is here. Gee, where am I supposed to go to place that order? Yeah. That type of information in the moment, that's what I need.
So does Elemento kind of encompass not only resources but knowledge and notes and kind of information on specific patients? Where does it cover in this broad umbrella of practice?
If you think about the electronic healthcare record, that is a patient-centered record of what we have done and what we need to do. It is all around the patient, and that means there's all kinds of firewalls and security all around that. Right, yeah. And we see Elemento like a yin and a yang. Mm-hmm. You've got the EHR here, and then you've got Elemento, which is a staff-centered platform of how to actually do it. We're about ease of access. We're about transparency of information, so the nurse can see what the doctor is going to do, or the nurse can see what the tech is going to do. How you can see the play before the play actually has to unfold. Yeah, how you as a teammate who's not directly caring for that patient can see how I can support my other teammates to get the bigger picture job done. Yeah. So because of that, we're about lightweight. We're about mobile. We don't need all the security around us. It gives you seamless access to information, whether you're at the bedside doing care or you're sitting on your own bed at home thinking, man, did I do that right?
Yeah.
That's the teaching moment to be able to see that.
Wow. So you've not only given doctors the abilities and nurses the abilities to help the patient, in the moment and in these certain situations and while they're caring for them, but even offsite, right? And kind of taking that information. Yeah. Wow. I mean, that's impressive, because I feel I had a certain situation. Long story short, I had an appendicitis. And it took me quite a bit of time, like 3 visits, to actually get, into surgery. And then when the surgery happened, it was an emergency surgery because my appendix had bursted. And it seemed as though we were starting at zero every time we went into the office. And, trying to get the care and waiting for somebody, it's just like, it's such a... I feel like when it runs well, it runs so smoothly and efficiently, but when it doesn't, there's all these kind of like speed bumps into getting the service you need. And like you said, it seems as though these people are very well intentioned. They know the information at hand, but it's the access and the quickness of communication. That's the biggest leap. And you mentioned COVID, and with monkeypox kind of being something that's now very prevalent and a little scary for those who are aware of it. What difference have you seen at Elemento on kind of helping with these care and services during these pandemic times?
Yeah, so if we look at an example, say UCSF, the emergency department at Parnassus, the main campus, is one of our clients. And for them, when COVID was at its peak, information was changing hour by hour.
Yeah.
And if you had to use a legacy communication system, either you're emailing people constant blasts, and who looks at all of it?
Nobody.
Or if you're trying to go through IT, open up a ticket, wait, somebody changes it in some central location, and you have to wait until you're back on campus that you can get behind the firewall and access it.
Wow.
But instead, they were able to leverage Elemento so that the director could directly, what's the latest? And even at the peak of the pandemic, people would look in multiple times during their shift to see what has changed.
Yeah.
What do I need to know right now? What's most current? And there's another fun twist to this, is that any institution, if they would like, they can make their operationalized plays shareable.
Yeah.
Shareable so that the team leaders, the directors in other hospitals, can look at it and can see, oh, I love how Julian's doing this in his hospital.
Yeah.
Julian's running an ED just like me. He's got the same problems I've got. I'm going to take that and I'm going to tweak that one step to really make it specific to my house.
Yeah.
And then I'm going to go. So we start to drive a democratization of knowledge and allow those to share with each other, so we get the strength of the community rather than each one of us reinventing the wheel.
I love that. It's so fascinating, when like CAPTCHA was first invented, which is, when you do where's the airplane in this image, and you select to verify information, and all of it is just community driven, right? How many people, what was percentage of individuals selected these images in these boxes versus another pool of people, and it's all by consensus. So this idea of like community information and learning is just, it's been done before, and it continues to be extremely relevant moving forward. But one thing that you mentioned about kind of the doctor and the nurse's experience is being able to do it at home. Like how do you feel the life the life experience and also professional experience has changed for these doctors and nurses now, having this information to take back with them and not having to be so tied to one campus to like communicate with other individuals? How has that changed their lives?
So for them, it's about, give me the information when I want it.
Yeah.
That teaching moment can happen anywhere, and it can happen at work, it can happen in transit, it can happen at home.
Yeah.
And when we look at our social life or the consumer life, it's about give me what I need when I want it.
Yeah.
So we want to give that same level. It should have the same level of expectation, same level of service in healthcare, where again the risks are so much more. So that's been a big satisfier for our clients.
Yeah.
And it's allowed them to also do their jobs better, because then even before you come into work, you can understand what you're going to see. You what's the environment like now, so what you can expect.
Right.
And so that ability for the manager is not forcing their staff to look at this somewhere else, but they're making it available. So whether, Julian, you want to see this when you walk in the door at work, or if you want to see this on your device when you're ready for it at home, fantastic. People have been able to take even some of the skills days, it's like big, intense trainings that used to be everybody get in a room and we're going to give you all this stuff at once, and you got to sit through these annual classes. Well, they were able to chop that up and deliver that in Elemento. You can consume it in bite-sized chunks whenever you want, wherever you want. And then the beauty is that you've learned it one way. 6 months later, when you have to do it, it's right there at your fingertips again to pull it in.
I love the idea of you getting the information and accessing it when you can, because I there's countless times that you're not ready to digest information where you're either your mind's waking up or you're focused on something else and you can't like switch in terms of your attention span. And being able to do it in a commute and having that access, I think is just I think it breeds more readiness in a lot of situations. And moving kind of into the discussion about Elemento and how it's impacted, different companies and businesses and healthcare practices, I guess. What kind of traction are you seeing now? Tell me a little bit more about the traction that Elemento has within healthcare and overall in the community. Yeah,
so we are now in 8 states. We're looking to launch in our 9th state a little bit later on this month, and then in our 10th state coming up next month.
Wow.
We've had 100% client retention. Our clients are all happy, and they are renewing. And then we've got a model where we start out and we prove it in one department, show success there, and then grow it out there, more departments ultimately to enter. So we've got clients that are at the level of individual clinics or individual departments, and we have clients at the level of enterprise. While hospitals are our biggest cohort of clients, we also have clients we're growing in ambulatory, that means in outpatient, and also in that post-acute care, which means empowering the folks in skilled nursing and home care and in hospice, where the workers are even more sparse. You can't turn around and ask someone next to you. You really need a digitized support there. And then we've even on the little more kind of the fringe, one of our biggest clients, they are dealing with the homeless population. And in this county that we're serving, we've been able to help empower the community healthcare worker so that they can access the resources from behavioral health and substance abuse and from home services and legal services, and bring those resources and connect those resources to the homeless client when they meet them. So making the county more efficient in being able to support those who are in the greatest need.
That's incredible. I mean, I feel like the web kind of continues and the network continues to grow and grow to support individuals, which is amazing to see because, like you said, there's just so many resources that just have the biggest issue of communication. And you see it in your day-to-day life when you're trying to set up for your own healthcare insurance services, right? Especially if you're like me who works for themselves. And that access is just so, I think it's necessary, especially during times where you can't get to places, people are working or have 3 jobs that they're involved in. So it's amazing to see that, there's a lot of traction within not only hospitals, but it's becoming more localized in the community. What are the biggest risks that Elemento faces today?
Biggest risks, so we're the first mover in this space. And we're a solution built from the bottom up. This was really built by doctors, nurses, and staff who were feeling this pain and saw a need for a solution. And so that's, how we started. Now we've got venture backing, allowing us to accelerate our growth. At some point, others are going to say that, hey, there's an opportunity here, and we want to come in and compete. So what's our biggest concern right now is drive that growth as fast as possible. And
have as many people adopt it. No, that's awesome. You mentioned to me earlier that
an important piece of that with that adoption, if you took all that we know in healthcare right now, if we didn't invent or discover a single new thing. If we simply applied the knowledge that we have, everybody's care would be ahead by leaps and bounds. Going back to your appendicitis story,
Yeah.
You know, that were first in the first place. You should have had, you know, that care that you needed ahead of time. And where we come in is that we take the knowledge that the department has, we make it actionable. We help those managers to implement their practices. And we make then those managers the heroes in their story.
Yeah.
We help them get the information to their front line so the front lines can take better care of their patients, get the outcomes that they want. And if you look at it that way from technology, it is not about us as Elemento. The story is about our clients.
Yeah.
We're helping our clients to succeed.
Yeah.
And if we can drive that, that's really the success that we want to see, because these people are all heroes and we want to make it known to everyone else that they are the heroes.
Yeah. I love that. I love that. I love that in terms of just like, I think a lot of founders from who I've been talking with, and even my own experience, it's like you let the client and the customer drive your story, because they need to be happy, they need to be satisfied, they need to be enabled to do what they do best in the most efficient way possible. So how do you go about like iterating on new features and new products, or expanding the reach of Elemento within its current customer base? How do you go about that thought process and that strategy as you're building? And I'm sure the building never stops, right? It continues until forever, it seems like. But that's part of the fun of it. But how do you go about thinking about how to best enable your customer moving forward?
So we like the idea of what we call new power. Old power is the historic structure of top down, from the king to the nobility to the peasants. That's been historic corporate America. That's been historic academia, the chancellor, the dean, the chairs, and taking it on down that way. In those models, information passes down to the front lines, and the front lines are simply passive consumers of information. The nurses just taking in the orders. New power is the idea of listening to those users and asking them not just to consume, but to help to produce information, to share information, to rate information. And so important to us in our product is getting that feedback of the front lines. The feedback built into the product. What do you want? What do you need? And so we help the managers to deliver that from a content standpoint. Similarly, we listen to them for what their needs are, and we bring that back to our product team through our client success. So we have continued to evolve our product over time to be able to apply to more and more of the pain points of our clients. So that feedback loop, whether it's at the level of the department for the manager and their team, or it's at the level of a product, is really key to us. And the other piece for us, when I talk about, we want to make these stars really the heroes in their stories. Much of our growth is through word of mouth. And it's about, like what we're doing on this podcast, but we have the opportunities where our clients are able to speak. And we want to be able to promote that, because, Julian, if you're an ICU manager in one hospital and I'm an ICU manager in another hospital, we may never have met before. We may never see each other because we're in our own siloed organizations. But when we're able to share our stories, or maybe even share some of our operationalized practices, we suddenly realize, hey, we've got a lot of stuff alike. How can we help each other? And that's the network that we want to be able to promote.
I love that. I've never heard of the old power versus new power concept, and I'm fascinated by that, because I think a lot of companies are adopting that in different ways. And I think one of the ways I've talked about recently is like community, and it's that shared information through that community resource that allows you to iterate, to take feedback, to make it actionable. I think one thing a lot of companies are moving towards is figuring out how to take on a certain situation as a team and sharing that success in that the overall outcome is a reflection of every individual part. And it really works, I think, well, not even just in, SaaS and those typical platforms, but even in healthcare and finance. I mean, it really, broad strokes, allows consumers or people or patients to get the care or attention that they need, and overall just drives success, and I don't know. I mentioned this on the last podcast, but it seems like the industry is going away from these unicorn companies where it's like very much one size fits all. If you can't fit within this box, then maybe this resource isn't for you. Versus companies who are more focused on fitting their resource around their product around their customer. And I just see so much success coming from that. And just in terms of the success and where the direction of Elemento is going, what's the long-term vision for the company? What's the overall goal, or what drives you every day to continue doing what you're doing?
Well, when we've seen the results at our clients of decreased medical errors, preventable deaths avoided, improved outcomes for patients, that's extremely gratifying, especially for me as a doctor. Is that for me the greatest thrill had always been, hey, you're in the ICU, you saved somebody's life, wow. But when we started developing the solution, we found it was a solution that was too important not to scale. And if we can enable more and more people to deliver better care to their patients, that's what brings them to work every day. We can help them that way. Awesome. And I've spent a lot of time in global health as well, working in developing countries about how can we improve their infrastructure. There have been many hospitals that I've been to abroad where they don't have computers, they don't have electronic health record. They all have this. Everybody's got a phone. And I talked about that sharing of practices. My big picture vision is that you take these operationalized best practices and you're able to share that with those that are resource rich to those that are resource constrained. Help everybody in this community outside of the borders of our country create something worldwide where we are the go-to network for operationalized best practices. And that can allow us to radically reduce medical errors and improve patient safety. And at the end of the day, empower every healthcare professional to deliver the best care possible to every life they touch. That's where we want to be.
I love that. That's incredible. I think that's a very courageous mission, and I think it sounds like it's working out extremely well. And again, I just love the idea of being able to empower people to do what they do best. I mean, it's not necessarily, it is a solution, right? But the solution in essence just helps people communicate with others and kind of create this big brain and symbiotic relationship within within these practices and these teams. And I love the team aspect because I think it communicates across so many different industries, so many different technologies. But ultimately, it is like what is the old saying? It's like, one smart person is not as smart as three dumb people, or something like that. I don't know if you've heard the saying, but I've heard that in the past, and but it's true. It's
I hear where you're going.
But it's the culmination of all that information that really kind of
everybody brings something to the table. At every institution, every one of your staff, there's something that they do really well. And if you can take what they do well and amplify that and share that with others, collectively, you're all going to step up.
I love that. I love to ask this bonus question, especially with founders having such diverse backgrounds. But what books or people have influenced you the most?
That would go back to where we first started. Atul Gawande wrote the Checklist Manifesto. It's a wonderful read, pretty short read, but it draws the analogy between healthcare and the airline industry about how both of these are taking the patient or the passenger on a journey from one point to another through a very high-risk environment and need to be able to make that journey safe. And the way that the airline industry has done this is by standardizing processes, but then also giving people that bite-sized information in the moment, the checklist in the moment, that the pilot checks off. Some of it is for routine work, but there's other that is for high-risk work. When something's going wrong, what do I need to know right now? Don't give me the book. Give me something straight and to the point. And the airline industry has moved by leaps and bounds. It's remarkably safe. It's amazing when you step back and think of how many millions of people are moving all the time. Safe. What we can learn from there in healthcare, where there are so many parallels. And our mission is help to actually realize some of the points that were brought up in that book originally.
I love that. No, that's, man, I feel like I learned something to take. Selfishly, I asked that question for myself to get some research material and some reading material. But yeah, the standardized checklist, I think, is just such a important message for so many founders and entrepreneurs, just to make things simple, actionable, and something that you can communicate to almost every individual on your org. And it does work in healthcare, it works in airlines, and it works in kind of everyday life too. Arup, thank you so much for joining the show. I really appreciate the insights and the interesting background, and love the mission that Elemento is moving towards in this, helping people get the care that they need, and helping teams kind of work together to improve their practices overall. Where can we find you? Where can we support you? Give us your blurb. Where are your socials? How can we become a part and spread the message on Elemento?
So we're elemenohealth.com, so ELEMENO health.com. And that comes from our core values. EL is to elevate quality, EM is to empower the front lines with knowledge, and EN is to engage as an interprofessional team. You'll also find us on Instagram, on LinkedIn, and on Facebook, and on Twitter.
I love it. We'll add all that to our post once we send out this episode blast. But again, thank you so much for spending time here. I really appreciate the story, and best of luck with everything with Elemento.
Thanks a lot, Julian. Appreciate it.
Yep.